Can you both share a little bit about the different types of trauma that one can experience and how there are different genetic and environmental things that also can contribute to depression?
Sure. Yeah, so I think trauma could be developmental, or it could be something specific that happens for one incident. And I think that how the person judges trauma is based on their previous experiences and their predictions of a lot of things in their life. And so, what we're doing every day is making predictions, and our body and our brain, our nervous system's making predictions as to what's going to happen next to help prepare us. So I think that a lot of times people are raised in environments that they're just coping and living in, and they then become adults, and then they get to evaluate what's happening in their life now and how that's based on their attachment styles and different relationships from being younger. So I think that there's a lot of developmental trauma that people don't put a big capital T on, because even though multiple traumas over time will really create such change in the nervous system. And I think that seeing a coach or therapist sometimes helps reframe that, and really helping people understand you've been dealing with multiple traumas based on the environment you were raised in, and you never really looked at that because you had to kind of protect yourself and keep moving on, and now you've developed into this person, but there's certain parts of you that don't have to be front and center anymore because you can take care of yourself. And it's really starting with them feeling safe within themselves. And so it doesn't have to be big T trauma always to use something like ketamine-assisted therapy, but I do think it is a tool for people eventually in the right setting with preparation to get to their peak performance. And it's controversial because we're using this as a medication for treatment-resistant depression. However, I think that a lot of people are just stuck in old narratives, and sometimes a medication can help shift them in a way that will just expedite their healing. And so it's really a tool to make the process go a little faster, and also have them have this real salient experience that they'll remember, that kind of lives in their cells, that they'll understand the ketamine disconnected them from this thought process, and now they're able to recalibrate their system. And so it doesn't have to be big trauma, and I do feel like this can be some medicine for people who want to actually improve their overall wellness.
I can say that because that was my experience. Like,